some of the viral skin infection, and the common viral skin infection can include varicella, varicella. So varicella infection means chickenpox infection. So you know what chickenpox is. It is a viral infection, and in Nepal it is known as chickenpox. Lage bhancha. थाहा छ कसैलाई? So chickenpox means Shola, okay? And it is caused by varicella virus, as varicella zoster virus, and this belongs to the herpes fildephili. So it is a type of herpes virus, and herpes virus that produces infection in humans are mainly of 8 types: herpes virus, human herpes virus 1 to 8, and varicella zoster virus, which produces the chickenpox. It is herpes virus type 3. So varicella zoster virus, it produces chickenpox, that is varicella, and in later life it can produce signals or herpes zoster infection. Therefore, varicella zoster. So varicella refers to the chickenpox that occurs commonly in the childhood, and once the infection has occurred during the childhood, the virus remains latent in the nerve roots, and in that person, if the virus has remained latent, once the infection has occurred, it can be reactivated in a later life, generally during the old age, and it can produce signals. So varicella zoster virus produces chickenpox or varicella and herpes zoster infection or signals. That is, in Nepali it is called Janekatila. That it can produce Theula and Janekatila, which is in a later life due to the reactivation of the virus. And varicella zoster virus, it is a herpes virus type 3. And you know herpes viruses are DNA viruses which are enveloped. So DNA virus, enveloped virus, and one infection it produces lesions in skin. Mainly transmission is through the respiratory droplets or contact with the fluid of the lesion. The virus enters through the respiratory tract, and the infected droplets are inhaled. So when the virus enters our body through the inhalation of the infected respiratory droplets, so it multiplies in the nasopharynx and reaches the regional lymph nodes of that area, and then enters into the circulation. So therefore primary viremia, and after that from the primary viremia they enter into the reticular endothelial system, and from that they get disseminated all over to the body, so different parts of our body, and they reside after that. They reside mainly in the endothelial cells of the capillaries and epithelial cells of the skin. Therefore, the involvement of the skin, and when the virus reaches the epithelial cells of the skin, there occurs fluid accumulation, resulting in the vesicle formations in around 14 to 21 days of the infection. Therefore, incubation period is around 2 to 3 weeks. Okay, so average incubation period 14 to 16 days, that can range from 10 to 21 days. So this is a blast-producing infection, so viral infection that is associated with skin rashes, and it can start as a macule and papule, which changes into vesicle, later into pustule, and then scab formation or frosting. So initially the blast starts mainly from the trunk region. So the appearance of the rash is centripetal in nature. That is, it starts from the center of our body, that is from the trunk, then spreads to other parts of our body, to the limbs and to the face region. Okay, and there are crops of lesion. So it can start. The first lesion will start as a macule, it will change to papule, and then vesicle, which is the fluid-filled lesion, and it can become pustular, and then after that the pustule gets ruptured and crusting occurs over the lesion, that is the scab formation. And again occurs when you examine a patient, you can see crops of lesion. That is, suppose the first lesion has started as a macule, after a few days it has already become papule or vesicle, then during that time when the next first lesion occurs as a macule. So at one time, when you examine a patient, you can see different varieties of the lesion. It could be a macule or a papule or a pustule and so on. Therefore, at one time, you can see different types of lesion, different stages of the lesion. So along with the rash, it is associated with fever and madness. So the main feature is rash, which is centripetal in nature. So you can see the lesions of chickenpox. So you can see here. देखिए सर
फिर स्लाइड चेन्ज भएको छैन
देखियो छैन
पैथोजेनेसिस छैन
पैथोजेनेसिसमा अड्क्यो I need to show you the lesion. Okay, and so map even ruptured and scab formation. So you can see at the time you can see a variety of lesions, either it could be a macule or a papule or just a vesicle or even pustule or scab formation. So that is the lesion of chickenpox. Now this group of varicella is generally older people or younger people or immunocompromised persons and especially newborns. Okay? And sometimes this infection can result in complications. One of the common complications could be encephalitis. The varicella virus can also be a cause of encephalitis as a result of complication of varicella infection. It can also be associated with pneumonia. So some of the complications could be pneumonia and encephalitis. So for the summary, so humans are considered as the reservoir. The only reservoir and transmission is to the droplet infection, that is the respiratory droplets, or direct contact with the lesion. And the infection is commonly in winter season, late winter or early spring. And transmission of the infection can occur before and after the appearance of the rash. So the patient may already be infected, the appearance of the rash will take some time, but the patient can transmit the infection. So around 1 to 2 days before the appearance of the rash, to around 45 days or even up to a week of the onset of the rash, or it may carry even longer range can occur. Now next, varicella produces next infection is the signals. It is not as such a next infection, but reactivation of the same infection that can that had occurred in the early childhood. So commonly chickenpox, it is an infection commonly of the childhood. And if the child is infected or has acquired the virus in some part of their life, they will develop the signals. Generally in the older age, when the immunity has become down. So with normal aging process, the immunocompetence is down, and during that period, there occurs reactivation of the virus. So chickenpox virus, that's the varicella virus, it is a herpes virus. So one of the features is latency, that is, it remains latent or dormant in some of the nerve root ganglions like the dorsal root, or in the dorsal root, commonly thoracic nerves, thoracic roots, or it can even involve the face nerve roots, that is the trigeminal ganglia. So the virus remains latent, and when there is when our immunity is down, it gets reactivated and produces signals, that is herpes zoster or zonoic. So it can occur years after the infection, generally during the old days. Okay? And it can occur in about 15% of the patient having chickenpox. So the latency is commonly in the dorsal root ganglion or the cranial nerves. In the dorsal root, it is common in the thoracic nerves, and in the cranial nerves, it can involve the trigeminal nerve. In trigeminal nerve, one of the common nerve involvement could be the ophthalmic branch of the trigeminal nerve. So they can be ophthalmic zoster, or the signals can occur around the eye area. Okay, so it can occur as a complication. So it can be considered as one of the complication of signals. Now the clinical feature, it produces vesicular rash. So it again produces a skin lesion, which is a type of vesicular lesion, and it is dermatomal. Dermatomal means since the virus is reactivated and it remains latent in one of the nerve root. When it gets reactivated, then during the reactivation, this lesion, that is the vesicular lesion, the cluster of the vesicular lesion occurs in the dermatome or the skin area supplied by that nerve root, that is dermatome. Okay, so dermatome means the nerve supplies a certain area of the skin, and that the whichever nerve is involved, the skin supplied by that nerve is through the lesions, and the lesions are vesicular lesions, cluster of lesions, so grape-like lesions. You can see a cluster of vesicular lesions at one part of our body, generally the thoracic area, the side of our body, commonly, and in the thorax, that is the thoracic part, in the middle portion, that is the side of our body. And it can clear within 2 to 3 weeks. The lesion will clear on its own within 2 to 3 weeks. And initially, it will start as a few lesions and it will go on spreading and spreading. Okay, and if we start antiviral treatment only within 24 to 48 hours, we may stop the spread of the lesion. Next, we may limit the infection. We start antivirals early in seasons. A laboratory diagnosis for varicella. So you can collect the fluid. If it is a vesicular or pustular lesion, you can collect the fluid, the scraping or the swab from the lesion, and prepare a smear and examine for the Jank cells. So you can prepare a Jank smear and look for the Jank cells, that is the multinucleated Jank cells, because these viruses cause syncytial formation, that is the cells are fused, so they produce giant cells. So a number of cells are fused to produce a large cell, which will therefore, since a number of cells are fused, you can see multiple nuclei within a single fused cells, which are produced from fusion of multiple cells. So multinucleated giant cells is one of the feature during the microscopy examination. And if you have facility for viral culture, you can obviously do culture in human fibroblast cells. And antigen detection, that is by PCR, and the commonly diagnosis is mainly clinical, and when you perform the laboratory diagnosis, the most common method would be sequential diagnosis, that is the detection of the antibody, IgM antibody with the rise in the titer. Complication, as I mentioned, ophthalmic booster, that is if there is involvement of the ophthalmic branch of the trigeminal. Commonly it involves the thoracic nerves or the dorsal root involving the thoracic nerves. So the common side would be the thoracic region, but sometimes it can involve the trigeminal nerve, that is also the ophthalmic branch of the trigeminal nerve. So you can see the vesicular lesion in the eye area, around the eye, sometimes even inside the eye. So that is the ophthalmic booster, and it can result in keratoconjunctivitis. So this can be considered as one of the complications of zoster. Treatment, supportive treatments, plenty of food, rest, and antiviral acyclovir. So acyclovir, if started very early, it can prevent the progress of the infection. And one of the complication, another complication, or let's say one of the sequelae could be neuralgia. So if treated early within 24 to 48 hours, the neuralgia may not be present because of the fewer lesions, but when the infection has spread, there's a number of lesions, then patient can complain of neuralgia or neuralgic pain for a long period of time, even up to years. Okay, so that was about chickenpox and seizures caused by varicella zoster virus. Another common infection, viral infection that is associated with skin lesions is the measles virus. So measles, it is one of the viral infection, and again you know measles, there is the presentation is the rashes. So mainly it is macular or maculopapular rashes. And measles virus, the family is paramyxoviridae, genus morbillivirus, and you know the classification of paramyxoviridae. And in the paramyxoviridae, measles virus is one of the virus belonging to the genus morbillivirus. The measles virus, since it is belongs to the paramyxoviridae, it is a RNA virus. So varicella was a DNA virus. Measles virus, it is a RNA virus, and it causes measles or rubella. Right? And other infections I'd like to mention here is that we consider 5 classic childhood rash-producing infections. Among them, measles is one of them. Other infections include rubella, roseola, fifth disease that is caused by the parvovirus, and chickenpox. So, commonly rash-producing infections in childhood, one is chickenpox, another is rubella. So that is similar to measles, but the presentation, the symptoms is less severe. It is less severe as compared to measles. So measles, it is called rubella. Rubella, it is another type of measles that is called as measles. And other infections associated with rashes in childhood is roseola and parvovirus infection. And measles, it is again a highly infectious disease. It can be transmitted easily, and transmission is again through the respiratory droplets of the infected patient. And again, incubation period is around 1 to 3 weeks, and individuals are infected before and after the appearance of rash. We can put a range of around 4 to 5 days before and after the appearance of the rash. Transmission, a pathogenesis of the disease, but this infection also transmission is through the respiratory droplets. And similarly, as to the varicella infection, so after the respiratory droplet, infected respiratory droplets are inhaled, they replicate in the respiratory epithelium and in the regional lymph nodes, and viremia occurs, primary viremia. After the primary viremia reside in the reticuloendothelial system and then get disseminated all over the body. And during that time, they localize in the skin, the skin, the respiratory tract, urinary tract, so they can reach different systems. So as they localize in the skin, so again they produce rash. So incubation period can range from 1 to 3 weeks. So average we can consider as 1 week. Okay, and it has 2 phases. Now the presentation of this infection, it has 2 phases. One is the prodromal phase, that is for the fever. And next one is the eruptive phase. Eruptive means eruption of the rashes. Sunirasa? Sunirasa is I know.
Yes, ma'am. Yes.
Sunirasa, slide will change with us, right?
Yes, ma'am.
Okay, so prodromal phase and eruptive phase. One of the phase is the prodromal phase. So it starts with the fever and it can last for around 2 to 4 days. So patient first presents with fever associated with cough, coryza, and conjunctivitis. Fever and 3 C's. That is cough, coryza means runny nose, and conjunctivitis. And after a few days of fever, around 2 days of fever, one of the pathognomonic features of measles is the Koplik spots. So Koplik spots are bluish or whitish spots surrounded by various area in the buccal mucosa. That is generally just above or opposite to the lower molars. So pathognomic, this is the pathognomic finding in measles. So fever for 2 days, and then Koplik spots appear after about 2 days of the fever, and after about 2 days of that appearance of the Koplik spots, then the rashes appear. So you can even sometimes when there is measles epidemic has occurred, or suppose there is in a school, few of the children have developed fever with rashes. Then suppose one of your close child develops fever, then after a few days of fever, you can look for the Koplik spots for the suspicion of the measles. And if you can find Koplik spots, then you can even before the appearance of the rash, you can think that child is having measles. So this can be one of the pathognomic finding of measles. So in this photo, you can see in the buccal mucosa, you can see a whitish or bluish spot which is surrounded by a reddish area. Okay. In this also they can be, you can see multiple Koplik spots. So this is a pathognomonic finding in measles. And after that, there is the eruptive phase. That is the eruption of the rashes. The rash type in this is macule or papular. So maculopapular rashes. And another feature of measles rash is it is centrifugal in nature as compared to the chickenpox. It was centripetal, that is started from the trunk and then spread to other parts of the body. In measles, it is generally centrifugal, that is starts generally in the face area, and commonly in the face area, also just around the ear or commonly behind the ear, and then it spreads to the trunk and the limbs. So maculopapular rashes associated with fever, and you can find the coptic spots. You can suspect of measles, and it appears and then disappears within a few days. So in this, you can see the measles, rashes, macular rashes, or you can palpate it, maculopapular rashes all over the body, trunk area. And complications, one of the common complications could be ear infection. So it can be associated with otitis media. So ear infection, pneumonia, and sometimes patient can have convulsions. And one of the rare complications could be encephalitis. So that is called SSBE, subacute sclerosing band encephalitis. So encephalitis, so this virus can also be considered as a positive version of encephalitis. Okay. Now treatment is again symptomatic treatment. Now for diagnosis, again similar. So antigen detection, it could be by the PCR, or you can perform the microscopy examination. So collect the exfoliated respiratory cells. In that we can detect is the virus. We can use electron microscopy, or we can use the immunofluorescence method for the detection of the virus. Isolation or culture, we can collect the respiratory secretion or the conjunctival swab and culture in human and monkey kidney cells. This also shows multinucleated cells. Okay. What we commonly do is the antibody detection. So IgM antibody, and with the rise in the titer can be significant. And vaccination, there is a vaccine available for measles. So these days it is available as MR vaccine, measles and rubella vaccine at 9 and 15 months. And we can also give the immunoglobulins if we have suspected the patient has come in contact. Now, other viral infection, I'd like to mention a few of them, just a short discussion. So some other viruses, as I mentioned, in the is xanthomatous childhood infection. One of them is rubella, another is parvovirus, P19, and warts. That can also be one of the viral infection producing skin lesions. Another is molluscum contagiosum and roseola. Rubella, so measles, it is rubella. Rubella means German measles, and that is caused by a different group of virus. So the family is Robavirus, that is different virus from that of the measles virus, and it is again an RNA virus. RNA virus is enveloped, but the clinical feature is similar. That is rashes with fever, and it is associated with lymphadenopathy. And lymphadenopathy is most prominent in rubella as compared to rubella, and generally hospital lymph nodes or posterior auricular lymph nodes are the common lymph nodes involved. And the infection is less severe as compared to the measles, but it can the infection is generally mild and self-limiting, but it can, if it occurs in pregnancy, then it can be associated with congenital malformation. So if rubella has occurred during the pregnancy, the baby can have birth defects. As I mentioned, clinical feature is similar to that of the measles, and lymphadenopathy is more prominent, and it can also be associated with joint pain or arthritis, that is inflammation of the joint. Next infection that can produce skin lesion is parvovirus infection. Again, transmission for this virus is respiratory infection, sometimes in transplacental. It is associated with fever, joint pain, and rash. And rash is generally as It's a slapped cheek. So sometimes it produces reddish area, reddish patches in the cheek that resembles a slapped cheek, and it is also more common in children. Rugella, that is again caused by human herpes virus type 6 and 7. It is also associated with fever and rash. Warts, warts are also viral infection. Warts are slightly raised, uniform lesions, and the common virus producing skin warts are human papillomavirus 1, 2, 4, and 7. So what is caused by human papillomavirus, which is also DNA virus. Next infection that can be associated with skin lesion is molluscum contagiosum, which is a pox virus, and it produces a raised pinkish lesion and which has a depressed center. The transmission to the contact with the lesion. And it is a self-limiting infection. So you can see the lesion of the molluscum contagiosum, which is around 2 to 5 mm, raised convex lesion, and the center is dimpled or pitted, and it is fleshy in color or color as that of the skin. Okay, so these are some of the skin lesions, and the common ones are varicella, or the varicella zoster virus, and measles. Is that okay?